Hi guys, welcome to our gross anatomy lecture series. Today we're going to talk about clinical coordinates regarding the inguinal canal. We're going to talk about the direct inguinal hernia and indirect inguinal hernia. So take note of this. Direct inguinal hernia are one of the most common hernia as that take part in the abdomen. Um, they they usually occur due to cough reflex and embryologically, you need to understand that the deep inguinal ring was once directly posterior to the superficial inguinal ring, but later it will move laterally, making the inguinal canal oblique, right? So you find out that we have ways that we how the inguinal canal is oriented in order to prevent inguinal hernia. For example, if we are talking about indirect hernia, as we're going to do very soon, you can actually discover that we say that in the anterior wall, we have the origin of the internal oblique, uh, reinforcing the deep inguinal ring. And in the anterior wall, in the posterior wall, we have the core joint tendon made by the transversus abdominis and internal oblique muscles um, that reinforce the superficial inguinal ring um, right anteriorly. So we have two main types of inguinal hernia. We have direct and indirect. So take note of this. If you remember very well from our umbilical fold lecture, we said that we have what we call a lateral umbilical fold. A lateral umbilical fold. So a lateral umbilical fold is made by what you call the inferior epigastric vessels. So the inferior epigastric vessels are it's an important landmark to differentiate direct and indirect hernia. So the indirect hernia, it occurs lateral to the inferior epigastric vessels, while it's direct hernia, right, it occurs medial to the um inferior epigastric vessels. So you can actually see. So the direct hernia is going to take part in the Hasselbeck triangle. If you remember very well, the Hasselbeck triangle that we said it was in the medial umbilical fossa, right? That was made by its medial border was made by by the linea seminolaris of the rectus abdominis. The lateral border was made by the lateral umbilical fold, which is the inferior epigastric arteries, and then the lower border was made by the inguinal ligament itself, if you remember very well. Right, so let's start with indirect hernia. Indirect hernia, it occurs in one third, right? Which means it is less common than, or we're talking about direct hernia. Direct hernia, it occurs in about one third of um, the abdominal hernia. It is less common than indirect hernia, and it is more common in male, especially old men, that have now weak abdominal muscles. You understand? So this direct hernia, it is called direct because it's it is not within the inguinal canal. So actually it's due to the weakening of the abdominal muscles, and then during cough you can actually have the small intestines bulging within this alphabetic triangle, protruding outside. So what it does, actually um, it actually uh, lives via the superficial inguinal ring, but not within the inguinal canal. You can actually see, right? So it can continue to grow and grow, and it lives via the superficial inguinal ring, but not within the inguinal canal. You understand? So it compresses the medial border of the inguinal canal, right? And it is not within the inguinal canal. And take note of this, this one does not extend to the scrotum. It does not extend to the scrotum, and it can be reversible. It is reversible, right? You can actually take your finger and put and press this intestinal loop, right, and it goes back. You understand? That is indirect. That is direct inguinal hernia. So direct inguinal hernia, we said it is rare in women. It is common in old men, and its inguinal sac is actually wider. So because it is not uh, passing through the deep inguinal ring, it is going to be wider as compared to this one. Good. Let's talk about indirect hernia. So if you remember very well, we said that the um, embryologically the testes, they originate in the abdomen, then they make their way to the scrotum. So we have a sac called the processus vaginalis. So the processus vaginalis, it is just a continuation of the peritoneum, right? Right inside your what? Your scrotum. So after birth or before birth, this processus vaginalis just obliterate the upper part, just obliterate, so that it disconnect the abdominal cavity from the tunica vaginalis cavity. You understand? So in direct hernia, it is a congenital hernia due to the uh, failure of the obliteration of the processus vaginalis. So there's actually going to be an open communication, right, between the abdominal cavity and the scrotal cavity, right? So you're going to have intestinal loops entering the deep inguinal ring, leaving via the superficial inguinal ring, and getting into the scrotum. You can actually see getting into the scrotum. So this is called the indirect hernia. Why? Because it moves through the oblique, entirely through the oblique inguinal canal. Good. So indirect hernia, it is actually more common in men. About 75% it occurs in men, right, than in female. And it is in men, it occurs mainly in young boys, right? Why? Because remember we said initially the inguinal canal, it would be a straight, right? So the obliqueness of this canal, it's also a way to reduce the risk of indirect inguinal hernia, right? So just imagine if this is straight, if the deep inguinal hernia is actually posterior to the superficial inguinal hernia, it is be the probability for indirect hernia will be high. So it takes place in boys, right? More common in boys, right? More common in male, and um, it is in it is also more common in the right than the left. About one third of indirect hernia is bilateral, which means it can happen. It happens at the same time in the right and left, right? That's one third. But in most cases, in two thirds, it is unilateral, right? And it occurs in the right. Why in the right? So if you're gonna see embryologically, the the left testis descends first before the right testis. So which means that the processus vaginalis of the left obliterates first than the processus vaginalis of the right. So therefore, the right um, inguinal hernia will be more common. The right indirect inguinal hernia will be actually more common than the left. And also take note of this. Just an interesting fact is that the left testis is actually lower than the right testis. because of the same reason. You understand? Uh-huh. Right, so let's take a look at this inguinal hernia, indirect inguinal hernia. So indirect inguinal hernia, it will be lateral to the lateral umbilical cord because it enters the deep inguinal ring, right? And it leaves via the superficial inguinal ring. Good. And it is actually differentiated from femoral hernia because it is above and medial to the pubic tubercle. Femoral hernia, it will be below and lateral to the pubic tubercle. You remember, right? Good. Let's look at this. This is actually a real picture indicating direct hernia. You can actually see this is direct hernia, right? You can actually see a bowel right here of a small intestine, let's say a small intestine protruding outside. This right here, that is your lateral umbilical fold, which we said if it is cut, it bleeds. And the lateral to the umbilical fold, we have actually the deep inguinal ring. And it is the deep inguinal ring, right, where we are going to find the indirect inguinal hernia. Here, medial to the lateral umbilical fold, you're going to have the direct inguinal hernia. Good. So let's look at this table. Right, so let's us compare direct and indirect. So the first thing that you have to understand, direct is acquired, indirect is congenital, mainly due to the failure of the obliteration of the processus vaginalis, the distal part, the proximal part of the processus vaginalis, right? So these are the predisposing factors, right? Weakness in the anterior abdominal wall, which occurs in a male greater than 40 years old, right? That is in old men with weak abdominal muscles, right? And then inguinal hernia is a patency of the processus vaginalis, right? Which occurs in younger people, like I said, in boys. Frequency, the direct hernia is less common, like I said, uh, is one third of the inguinal hernia, right? And then the indirect is actually more common, right? Two-thirds, and actually more common in male than in female. Even the direct is more common in male than in female as well. And then the exit from the abdominal cavity. So you understand that the direct hernia, right? We have the peritoneum plus the transversalis fascia, and it lies outside the spermatic cord, right? While is the indirect, right? You're going to have the persistent process vaginalis as part of it, right? And all those three fascia covering, right? And then the cause, take note of the cause. The cause of the indirect of direct hernia, it passes through the or around inguinal canal, right? Usually transversing only the medial side of the canal, but external and parallel to the vestige of the processus vaginalis. It's not within the processus vaginalis, right? But the indirect now, it transverses in the inguinal canal, right, entirely, and it's gonna be within the processus vaginalis. And then lastly, exit from the anterior abdominal wall. The direct inguinal hernia, right, it exits via the superficial ring, lateral to the cord, and outside. It will be outside the spermatic cord, so it will be lateral, right? And really enters the scrotum. Usually does not enter the scrotum. And then the indirect hernia via the superficial ring, and commonly pass into the scrotum and the labia majors in female. So thank you so much, guys, for understanding this. It's actually very important to understand, lastly, that the difference between the inguinal hernia and femoral hernia is that the inguinal hernia is above and middle to the pubic tubercle, while the femoral hernia is below and lateral. via the femoral canal. We are going to talk about it in the lower limb. Thank you so much. Take care.